Hi, I'm Dr. Beth Snyder. I'd like to talk to you about something I'm very passionate about, which is treating sleep apnea. How do you know if you have sleep apnea? I would ask you a few simple questions. First of all, do you feel rested in the morning? Do you feel like when you wake up, you've had a full night's sleep? Do you feel like you could use a nap in the afternoon? Let me explain the different things that can happen during sleep. Besides normal sleep is you could be snoring, which is an obstruction in the airway, which is making the noise, the kind of sound. But besides snoring, there's sleep apnea. And I'd have to ask, do you find yourself gasping, you're sleeping and you wake yourself up that way? Or perhaps your bed partner or roommate says, I notice that there's times when you stop breathing. Just think about that one. Is it okay to stop breathing? You could have something called a hypopnea, which is a low breathe, where you're not getting a full breath. It's a low breath, and because it's not a full breath, there's some kind of obstruction, the oxygen level drops down. So you can only imagine the strain that that has on one's body if you're not getting oxygen to your brain and to your other body parts. Sleep apnea can cause heart attack, stroke, daytime sleepiness. Many times people complain that they fall asleep while driving. There have been many bus accidents, car accidents, and even train accidents as a result of people falling asleep due to sleep apnea. How do we treat sleep apnea? Most people will find that their doctor will encourage them to get a CPAP. A CPAP is an appliance that you wear on your face that has either nasal pillows or a face mask that goes over the whole face, and it provides continuous positive air pressure, hence CPAP. What that does is it holds the airway open so that way as you breathe in and you breathe out, there's no resistance from whatever was obstructing your airway. However, if you don't think you'll wear one, there are other answers. If you obstruct, and I can position your jaw in a better position and it opens your airway, it doesn't matter if you have mild sleep apnea or severe sleep apnea, we may be able to treat you. The way an oral appliance works is very similar to if you've taken CPR. You know that when you find your victim, they've obstructed, you position their jaw in a forward position to open up their airway. And that's all you're doing with an oral appliance, opening the airway so the air can get through. The oral appliance is very custom fit to the patient. We take specific impressions to your mouth and we take a registration of your bite so that we make sure that we're going to hold your jaw in that position to keep your airway open. Let me show you some of the appliances that we make. This is an example of an oral appliance with something called dorsal fins or wings. And you can see that when you fall asleep, the jaw falls back and people obstruct at the back of the throat. So what this appliance does is it uses these wings to hold the jaw forward. This little gear here allows us to calibrate it and protrude the jaw a little bit more forward if we need to. This is another appliance that we make, and while it looks like maybe a lot to have in the mouth, it's actually extremely comfortable, and these little bars on the side allow the jaw to move around, and yet it keeps the jaw from falling backward. So we're very fond of this, and this happens to be an appliance that Medicare approves. This is another appliance that I'm very fond of. This is called a Narval, and it's made using CAD/CAM technology. So the company takes your models and it actually mills out this piece of nylon to make the appliance. It's extremely thin, extremely light. It looks like a kid's toy, but it is a very powerful appliance and also very, very comfortable. Now that you know what it is that we do and you know more about sleep apnea, our goal is to have you leaving feeling refreshed and awake in the morning.